Hi, my name is Delene Grant, and welcome to part 8 of my presentation on TPP Disability, Ontario Nicolini Law, Adrian Nicolini and Ashlyn Steele, 2022, continued. I'm still on TPP Disabilities decision, okay, and I already told you that what you're about to see, you have already seen these evidences that I have. I'm just trying to put them together with the decision by CPP Disability if you're in agreement, because I think I complied, and I think my right, I guess, was they were trying to violate my rights, I guess, that I should not make certain decision regarding my health. But please feel free to pause and read as you go along. But you're already familiar with what I'm about to show you. Okay, thank you. Again, we are already familiar with this, appearing on all my presentations regarding CPP disability, right? No contract was presented to be retained by Nicolini law firm, and we are dealing with CPP disability where this lawyer acted on my behalf without my consent and all that. Okay. 2022 part 2 of 3. Recap as per CPP bias decision dated April 12, 2022. Okay. Still on Dr. Handelsman. So I brought this forward again because we're still on the fact that it says I did not follow medical advice. So tell me if you agree with the CPP decision, okay? Dr. Sam Handelsman, non-compliance. Okay. On July 26, 2017, I refused the cortisone injection as per requisition for ultrasound, confirmed in Dr. Handelsman report dated June 12, 2017. If inflamed, inject. I can read. All right. And I have understanding, which I believe by now all of you can recognize that. All right. My injury was 1 year and 1 month old in July 2017. Saw Dr. Handelsman on June 12, 2017 and was once again provided with a requisition for the Sunnybrook Hospital for the injection. Okay? Requisition stated if inflamed, inject. As a matter of fact, as soon as I entered Dr. Handelsman's office and he saw me, he got up angrily. He got up and actually was storming out. He just didn't want to deal with me. He's like, what did I do wrong? Wow. But I kind of understood because he didn't want to deal with money life. He didn't want to deal with money life. So he told me he was sending me back to Sunnybrook. He did not examine me or anything. I just asked him a question. Doc, please, just have a question. Why is my hand still swollen? And he just said, I don't know. And he left the room. Can you imagine? Then I had to take myself. I just took my time and went out. And I got the requisition to go back for the injection. Okay. When the Sunnybrook Hospital confirmed Dr. tendinitis in the 13th month, July 26, 2017, 13th month of my injury. But there was no fluid, no inflammation in the area, therefore did not warrant an injection. Dr. Monique Christakis had decided to still proceed with the injection. The requisition said, if inflamed, inject. Okay. There was no fluid, no inflammation, right? So I asked Dr. Christakis the reason, right? And she said that Dr. Handelsman stated I should still be injected on that day. What were they trying to do to me now? To damage me? In February, I was told by the doctor, right, at Sunnybrook, that the cortisone injection need fluid. Inflammation has to be there. So what would have happened to my hand when there was no inflammation there? What would have happened? Wow. This was against the education I received about the injection on February 15, 2017 at Sunnybrook. And also the requisition which clearly stated if inflamed, inject. I had to refuse. It was my right. It was not required. It was not required. Okay? Feel free to read as I go along. Thank you. Yeah, this is just, you can review if you like and read. I've already been through this, right? It shows here on June 12th and was still swollen and in pain. July 26th, 2017, Sunnybrook Hospital confirmed death of intensivitis. No information present, but moderate focal tendon sheath thickening within the first compartment. I still have death of intensivitis. Okay, feel free to pause and read. Okay, thank you. Dr. Monique Chriskarkis, Sunnybrook Hospital, informed Dr. Handelsman that I refused the cortisone injection, the injection that was not required as per requisition, no information. You would agree, right? Okay. This information was provided to Money Life Insurance, which was communicated to Bell Mobility. This deception allowed Bell Mobility to place me back in my regular position, part-time, effective August 2017, that is, sorry, and full-time effective October 2017. Okay. It's like I am delaying my recovery. I want to get better. No, I don't want further damage to be caused to my body. No. Okay. And as you can see, the report that Dr. Handelsman wrote on the 12th of June 2017, right, indicated that in February of this year, she was seen at Sunnybrook Hospital imaging, right? And he indicated that she had a schedule to return back to work but still does a different job. Okay, here it says today. This is what it says. Oh, let me backtrack. It says in February of this year, she was seen at Sunnybrook Hospital imaging, and on US inflammation could not be detected to warrant a cortisone injection. See that? Inflammation could not be detected. Okay, I was not examined by Dr. Andersman when I went on this date, the 12th of June 2017. Okay, today, on physical examination, there is slight puffiness over the dorsum of the right distal forearm. The thing is, you see, my injury did not change from what he saw in March. And here he was giving an indication because Money Life actually stated that I was better and then I got worse. I got worse. Okay? In June, because the injury returned. Okay, it didn't go away. All right, then it says here, thus at present she may have a right decovein tendonitis. It is doctors, so giving impression that, oh, it's not Bell, I went back to work and I wasn't using my right hand, I was using my left hand. So now the right hand is still showing swelling now and all that. But before it was okay. You see what I'm saying here? Here he indicated if there is no inflammation not warranting an injection, right? If there's no inflammation not warranting an injection, here it still stands, all right? Here it says if inflamed, inject. This is the date I went, 12th of June 2017. Okay. Okay, clearly this is what, please feel free to read. Today on physical examination, there's slight puffiness. I read that to you. Okay. There it says, thus at present she has a right decovein tendonitis. Did not go away. No, it did not do right by me when I returned to work. Okay. Then it says, if there is no, if this is the case, then this could be followed by modified work. Let me go back here. As stated previously, I will repeat the ultrasound of the right thumb abductor and extensor tendon sheets, and if inflamed, inject with a small amount of depot-metral. Okay, if this is the case, then this would be followed by modified work. If there is no inflammation not warranting an injection, okay, and you can read the other part. Okay, as it says here, and if inflamed, inject. 12th of June 2017. Okay, it was not inflamed. Okay, I'll bring this up larger on the next slide. Here it says what cortisone is for, what the injection is for, right? Cortisone injection. It says cortisone is used as an anti-inflammatory medication. Okay? Okay, if inflamed, inject. 26th of July 2017, Sunnybrook Hospital, Monique Christakis, and she said, no simple, whatever the word is, peritendinous fluid, okay? But there's thickening. I do have decovane tenosynovitis, but no fluid. So if there's no fluid, the patient was offered an injection. Why offer me an injection? You see, this doctor, Monique Christakis, was setting me up. There's no fluid. And then she's offering me the injection. And then she's saying, but I refused until further investigation. I actually told her, when I asked her questions, right, about my hand, she told me she did not know. So I said, well, if you did not know, why are you going to inject me, right? And then I said, what about an MRI? And then she said I should go to my family doctor, let him recommend that I do an MRI, right? So I said I need further investigation, right? But they gave the impression that I didn't want to get better, and I refused the injection. Till my doctor was even angry with me, the way it was presented, till my workplace forced me back to work and all that, full time in my position. Okay. This is where it didn't really just start here, but they made it worse for me here, okay? Again, as I said, what cortisone is for. Requisition for Dr. Hanselman stated, if inflamed, inject. There was no inflammation. Dr. Christakis, right? It was not a medical reason she gave when she told me that Dr. Hanselman requested that I should be injected that day. Would you have taken the injection? If you were me, would you have taken the injection? Okay, Dr. Christakis stated that I should ask my doctor for MRI, as I did indicate, right? But she indicated that I refused the injection when it was not required. Okay, please feel free to pause and read. So this one, I would say I did not comply with the doctor. Would you have complied? Okay. So Manulife Insurance Company, yeah. She did say I did not comply. She said cortisone injection has been recommended on several occasions by Dr. Handelsman. We note that Dr. Christakis performed an ultrasound of your right wrist on July 26, 2017, and this ultrasound was demonstrating moderate focal tendon thickening. In this report, it is noted that you refused the injection. Injections were also, I won't go any further. No, Manulife Insurance, this person, Adele, she's thinking that the injection was for the thickening of the sheet. No, that's what the impression they gave to Manulife. The injection was for inflammation. It was not for the swollen thickening of the tendons. That's what Manulife here is saying, right? Demonstrating moderate focal tendon sheet thickening. In this report, it is noted that you refused the injection. I can read and understand. So Manulife is thinking that the injection was, or trying to be smart, because they must have received requisition that it says if there's inflammation, inject. It didn't say if there's thickening of the tendons, inject. Okay? All right, please feel free to pause and read, because based off this, I've already explained it was already too late. It was already too late. They took too long, so it will not work. The cortisone injection wouldn't even work. All right, please feel free to pause and read. Thank you. And I've enlarged it for you. Okay, please feel free to pause and read. I will deal with this on another section. Okay. I'm just dealing with Dr. Handelsman right now. Thank you. As per Dr. Handelsman, because they actually made mention that this was from Manulife, this was the information that is enlarged. All right, it says, I've already read this portion on the previous page, but it says Despite Dr. Silverberg's comment regarding his opinion on your ability to resume work in your current role, we feel that this treatment should be considered prior to forecasting this conclusion. Right? Dr. Silverberg commented, this was his comment: there is no medical treatment that can heal an injury. She injured herself performing her job, and the pain will increase if she returns to that job. That's what he said. Okay? And he told me that the cortisone injection will not work, not at this stage. And he explained to me. And again, as I said, I have understanding. He couldn't make up his mind. He couldn't even make up his mind for me. He told me, he gave me the option. It's not going to work in space of 2 weeks or less. All right, it may just give me temporary relief, but it's not going to make me better. It's not going to heal my injury. The cortisone injection will not work at this stage. So will you still take it? The doctor already explained. When I was a bit surprised when he asked me, but he said, no, it's your decision. So he has to ask me. He couldn't make the decision for me. So I told him no. So he was fine with my decision. Okay, what would you have done? Okay. Here, November 17, 2017, this was Dr. Silverberg, part of Dr. Silverberg's report. Okay, I just brought this forward just to show you how Dr. Handelsman was biased. I know Dr. Handelsman was, I don't know, should I say racist or it's discrimination here? I don't know it did not assist me at all. And I thought I was in the hands of like a good specialist, right? To hear Dr. Silverberg says, even with a local cortisone injection, he said, we discussed, you see the word, discussed? Yeah. We discussed a cortisone injection, but she chose to defer. Yeah. And he was in agreement, right? Even with a local cortisone injection, the patient would not, in my opinion, be suitable candidate to return to our previous vigorous keyboarding job. There's no specific treatment for soft tissue injuries, and I do not anticipate improvement in the future. That November 17, 2017, I was still diagnosed. It says patient has post-traumatic right wrist decovein tendinosynovitis. Please feel free to pause and read. I went through this already. Okay, thank you. When I reported Dr. Handelsman to the College of Physiotherapy, College of Physiotherapy, College of Physicians, College of Physicians and Surgeons. Yes, see, CPSO, College of Physicians and Surgeons. Okay, this was the letter from Dr. Handelsman to Mr. Roddock. Okay, and it says here, Miss Grant was referred to Sunnybrook Hospital, Sunnybrook Imaging, and assessed there in a timely manner on February 15. It was not in a timely manner. My injury was actually 8 months. 8 months when I went in February. The ultrasound finding detailed in the report, she had tendon thickening, but no fluid, no fluid. And because of the no fluid, it says that the sheet was not injected. You see that? It was not injected. Then it says here, following the ultrasound of February 15, 2017, I received from Moneylife on February 23rd, 2017, a proposed return to work schedule. As per my reply of February 23rd, to be fair and objective to Miss Grant, I did not feel she could return to work. I thought so, right? Yeah. To the work schedule pending assessment, okay? On March 7th, 2017. I was not assessed. He said, when I was assessed, I was not assessed. And he talked about improvement here. I did not improve. I was not assessed by Dr. Handelsman. He's trying to cover himself here, right? Then it says here, when I reassessed her, I was not reassessed. As soon as Dr. Handelsman saw me, he was storming out of his office, okay? I'm not making up stories here. I'm telling you exactly what happened, right? But then it forced me to go to Sunnybrook Hospital. Then it says here, she did have her repeat ultrasound. Yes, I did, on July 26, 2017. Based on the report, there was still some findings of right decovein tendinosynovitis. Yeah, it didn't go away, right? Relatively mild with no report of fluid. There was no fluid, okay, in the tendon sheet, and no report of hyperemia. From the report, this was not where Miss Grant was symptomatic or whatever that is. It says no injection was given. No injection was given because, you know why no injection was given? Because there was no fluid. Okay? But he could have said, if I did something wrong, he should have said, I refused the injection. He said no injection was given. Huh? But he told Money Life and everyone else that I refused the injection. Please feel free to pause and read. Thank you. Placed back in regular position with painful swelling in her right hand, okay? Where I went through that, okay? I was told I was 70% at work, then 80%, 90%, then 100%. Please feel free to pause and read. Try to go faster. Thank you. Okay? So I went to Great Lakes Medical September 16, 2017, because I was refused by Dr. Handelsman. So the doctor at Great Lakes said, you know what, Dr. James Chang should send me to a physiatrist. They see my hand. They see my hand here, October. This is September. This is my hand at my desk, 7 months, working with the left hand. This is my right hand, eh? And Dr. James Chang refused to take me, send me to a physiatrist. Okay? I'm so glad, thank God I was taking pictures along the way. Didn't realize I would have been so important. Okay. Okay, I was off work due to death of intestinal cervicitis, that it says here, October 13, 2017, and this was taken on the 15th of October 2017, okay? I was at work using my left hand in a fast-paced environment, working for 7.5 hours. 7.5 hours. 2 minutes break and 1 hour lunch, and I was at my desk using my left hand. Can you imagine? Okay, here I have the splint on, okay? Off work again, effective October 25th, 2017. Both hands were now in pain. Okay. Please feel free to pause and read. I went through this already. On the 26th of October 2017, right? The doctor's note from my family doctor, Dr. James Chang, right? I went to Dr. James Chang's office on the 31st of October 2017. I could not get an early appointment. I was off work on the 25th of October 2017 with both hands in pain, and he had to backdate the doctor's note to the 26th of October 2017. The reason why it's 26th and not the 25th, my doctor's office is not open on Wednesdays, and Wednesday was the 25th of October 2017. Okay, please feel free to pause and read. Okay, I've already been through this. Thank you.